Hello everybody, it's Dr. Sandra Lee, aka Dr. Pimple Popper. I get some questions every now and then, and so that's what I'm gonna do today. I'm gonna answer some of your questions. What inspired me to become a dermatologist and how did I become Dr. Pimple Popper? I'm a dermatologist because I was really exposed to dermatology at a young age. My dad's a dermatologist and I'm very happy to be a dermatologist. It is such a wonderful specialty, very rewarding in so many ways. And then 10 to 15 years into my practice, I became Dr. Pimple Popper. Just started posting on social media, blackheads and whiteheads and pimples, and people were interested, so I kept throwing another blackhead on the fire, as I say. And I was trying to create an Instagram page and I was trying to create a Reddit page, actually. That's where I first started because people were saying, you should post this stuff on Reddit. And there was a whole group of people, they were sharing pimple popping videos with each other. And I realized, I didn't know much about Reddit, but I realized that everybody had an anonymous name, so I knew I had to create a name there, and so I just thought of Dr. Pimple Popper. Since then, it just grew, and now we have so many people on social media following us, YouTube channel, and I have a television show, and that's how I became Dr. Pimple Popper. What is the most memorable case that I've ever worked on as Dr. Pimple Popper? There's a lot of patients that I've seen that have impacted me in many different ways. I really can't put my finger on one. I would say there is a patient though that had really bad blackheads. We called him Pops. He kind of told us a story of how his wife had passed away recently and that he was going to have to move out of his house. I was posting these videos and people were falling in love with him, even though they didn't know his name, they didn't know what he looked like, and yet it prompted me to start a GoFundMe for him, and we raised like I forget what it was, I think it was $12,000 or so for him, and presented it to him, and it was quite amazing. He was shocked. He knew he was being taped, but he was really shocked and really, I think it really brightened his life in a very dark time. So that was really special. But there's been a ton of people for many different reasons. Mama Squishy, so many of the people on the show. There have been a lot of people that have impacted me in many ways, many positive ways too, and I'll never forget them. Have I ever been grossed out by a case and how do I handle it? I would say I'm least grossed out by cysts and pimples in general. I am more grossed out, honestly, by I don't love feet. I don't love toenails and things like that. That's just more like my little ick, you know? I'll definitely take a look at these areas. We look at the entire body. So it's not like it doesn't bother me because I think part of it is mentally I don't let it, because I think that's very important. And I do a lot of pimples and cysts and abscesses even. And I have to be very careful to present myself in a way that doesn't make people feel embarrassed of coming in. So I think that that's part of just the training and with that in particular. I don't like diarrhea, I don't like throw up, I don't like any other bodily kind of emissions, I guess. But I don't mind blackheads or cysts or lipomas or that sort of thing because I'm wearing gloves. And most of them are not really smelly. Maybe only an infected or inflamed cyst might be a little stinky. If you have a limited budget, what are the top 3 skin products that you should use or you should look for? It depends on what you're looking for, right? It depends on if you're young and you have normal skin, or do you have oily skin, or do you have dry skin, or are you older? I would say sunscreen is probably one of the most important things for everybody, most everybody. If you're talking about anti-aging, probably the number one thing is a retinol or a tretinoin. I think vitamin C is a great antioxidant. It's great for anti-aging. It's a great skin brightener too, so that's another option. And like an exfoliant, something that has like a chemical peel ingredient in it, whether it be glycolic acid, salicylic acid, lactic acid, that's gonna help to get rid of that kind of the dull layer on your skin and make your skin look brighter. Does Dr. Pimple Popper have kids? Yes, I do have kids. I have 2 boys and they're in college now, so we're empty nesters. Actually, that's part of the new television show. We're talking about how I've moved to a new house because we're empty nesters and my kids are out of the house, and So we're having a new sort of life here, you know, me and my husband. Does Dr. Pimple Popper skin tag remover work? Well, you might have seen those ads maybe when you're playing a game or on like a news site that you're reading. That's not my ad. Somebody is taking my face, my image, and maybe my words and making it look like I'm selling the skin tag remover. That is not my skin tag remover. I don't think it works. I'm pretty sure it doesn't work. It's not my product. I am not endorsing it, and it's really hard for me to get them off. It's like I get rid of them. It's like whack-a-mole. You kind of hit them a little bit, and then they pop up somewhere else. So don't get it. Don't buy it. I do have SLMD skincare, but we don't have a skin tag remover there. Does Dr. Pimple Popper have cheek implants? No, I would say no. These are my cheeks. I am of Asian descent, and I think a lot of my relatives and people from the area of the world that I come from have cheeks like this. And yeah, I mean, those are just my cheeks. I'm very lucky to have those cheeks, I think. If I weren't a dermatologist, what career path would I have chosen? I mean, I jokingly have said in the past that I'd be like a professional potato chip taster because I love potato chips, but that's obviously not going to sustain me. I don't know. I don't know what I would be. There's things that I like to do that I enjoy doing, but they don't generate an income for me. So I don't know if I could make it into that. A lot of people have done that though in the past decade or so with social media. You know, they've made something that they've loved to become a source of income for them. So who knows, I guess. I love to do crafts. I love to work with my hands. I love to create things like that. And that's probably part of why I love dermatology. So I don't know what I would do. I'm not sure. I don't know. What do you guys think? What's my favorite self-care ritual outside of skincare? I mean, self-care ritual? I don't know, getting in bed and eating my potato chips. Is that like my self-care ritual? I think I need to pay attention to that more. I don't think I put enough time into that. I think I think like a lot of people, I probably put myself a little bit last in terms of trying to take care of myself. I say yes to a lot of things and I regret it later. So I don't know. I'm not sure what I do. I try to work out. I haven't worked out as well lately, but I need to get back. I relax with my cats. I take care. I hang out with them, and they certainly take the stress away. How do I deal with criticism or negativity on social media? Well, first of all, I'm very lucky, I think, to not see that much, or I don't get it that much. I don't really look at the comments, and I think I look at some of them certainly, but I'm not like riveted by them. I don't pore over them, and I think it's unhealthy to do that. I think I look at them to help make me maybe a better poster or a better dermatologist, you know, be better on social media, but I'm not looking at them to see what they're saying and analyze everything that's going on there. What is the best piece of advice that I've ever received, either personally or professionally? I mean, I have a lot of people's advice, a lot of mentors in my life that have influenced me in positive ways. The things that I can think of off the top of my head is, you know, a Dr. Bernie Ackerman, who's a famous dermatopathologist, who really kind of taught me to not really take what everybody says as just what's right, even in textbooks. I mean, think for yourself. Really think for yourself and form your own opinions and with all the information that you can get. I think my dad has taught me so much. He's a dermatologist, and he certainly has taught me to, you know, treat your patients as if they're your friends, and they are my friends. And I think that that's really important. I think being happy at work is really important because it's sort of contagious. And if you're happy and upbeat when you see your patients or you just interact with people, it has an aspect of it transferring to them so that it makes them feel good too about the day, you know, about the day and about living, you know. Those are the main things I can think of. Okay. What's the most common skincare mistake that I see people make, and how can you fix it? A bunch of things, like thinking that you can get a base tan is helpful for you. You know, if you get a base tan that actually is helping your skin, it's not helping your skin. Picking at their acne bumps. I mean, I know you watch me pick or remove acne bumps, but you shouldn't be picking them. If you have an area that you're suspicious of, you know, trust your instinct and really see a dermatologist and get it looked at. Oh, what happened to Dr. Pimple Popper? I don't know what happened. I'm right here.